Okay, seems that we can start. So hello again, my name is Claudia. I'm from Sensing Future. I am a biomedical engineer. I work mainly on the innovation and scientific development of PhysioSensing. We are specialists in technology for force and pressure platforms with wide applications in physical and vestibular rehabilitation, as you will see in this webinar. So today I am pleased to present to you our sixth webinar about PhysioSensing. I'm sure that you will be impressed. So let's talk today about the balance error scoring systems, the BESS test. But first, let's talk a bit about the balance. So if you saw the previous webinars, I always like to start at saying what is balance so that we can understand better the meaning of measuring it with the devices like ours. So what is balance? Balance is the ability to maintain the body center of mass over its base of support. So the center of mass is the mean position of the object, and you can see the center. Okay, now you can see the center of pressure point here, for example. And then you can see here the center of pressure, which is the projection of the support surface, representing all the forces on the plantar surface. So this is the physical foundation of instrumented platforms like ours, like with the force or the pressure platform, which obtain this golden measure, the COP, or the center of pressure. So when the center of pressure is over the base of support, the body can get unstable and even fall. So how balance works? Balance is achieved by a complex sense of sensory-motor control systems like you see here, which includes sensory input from vision, from our sight, proprioception, touch, muscle joints, and also the vestibular system, including the sensory, the motion, the equilibrium, the spatial orientation, which is all sent to our brainstem, and then we have the integration of all these inputs that are sorted, and here you can integrate all this information. The cerebellum provides information about automatic movements that we have learned to repeated motions. For example, I always tell this example when practicing serving a ball. A tennis players learns to optimize balance control during that movement, and so the sensory integration takes place, and the brain stem transmits the impulses to the muscle that control the movement of the eyes, the head, and the neck, the trunk, and the legs, allowing the person to both maintain balance and have a clear vision while moving. So that we understand a bit about the balance, let's have a look at what the platform measures and understand better the balance error scoring system protocol. So the balance error scoring system is a well-known tool to evaluate the effects of head injury on static postural stability or standing still in different positions that you will see. This protocol is often used in athletes after sport-related concussions or mild traumatic brain injuries. The balance error scoring system was developed by researchers and clinicians at the University of North Carolina Sports Medicine Research Laboratory at Chapel Hill, so as to provide a quick and efficient tool for balance assessment that could help health professionals in making return-to-play decisions after mild head injury. So this scale, it has 3 different stances, like you see here, and it starts with the 2 feet together on the firm surface. Then we have only with one leg, using the non-dominant foot on firm surface, and then the tandem position with the non-dominant foot behind the other foot, also on firm surface. Then we repeat all these stances using a foam to create an unstable surface. So this is the protocol that was created, and each condition has one trial with 20 seconds, and they should be performed with the eyes closed and hands on hips. In the traditional BESS test, scoring is time and error basis using a stopwatch and counting the number of errors. So the number of errors are listed here. So when the patient removes the hands from the iliac crest, or they open their eyes, when they stumble or fall, or when they move too much their hip, when they lift their foot, or when they remain out of the position after 5 seconds. The maximum number of errors for a single condition is 10, and if there are multiple errors occurring at the same time, only one is counted. The total error that we have for the balance error score can be from 0 up to 60, and higher scores indicates poorer performance. In the PhysioSensing, we also have in our software an improved version of the traditional BESS. With this solution, time and error counting is enhanced with the objective quantification of sway using the PhysioSensing pressure or force plates to obtain the center of pressure data on each condition, and the health professional can also add the number of errors in the interface of the software. After performing all the conditions of the protocol, the following results appear with the trajectory of the center of pressure for each condition, and also several parameters that you see here. This is just to give a global view of the results. So now let's understand the meaning of each one. So during an upright body position, it is possible to quantify the small corrections that we perform to oppose the stabilizing effect of gravity. So this stabilization of the body is visible on the center of pressure trajectory, as illustrated here for each direction. You can see for the mediolateral direction, so left and right, and for the anteroposterior, front and back. The instrumented solution like ours with force or pressure planes can then obtain this sway displacement during a period of time, like you see here, for both directions. This means that the body sway can then be translated into a center of pressure values in the medial and the anteroposterior direction, as displayed here in what it is called a statokinesigram. Note that the center of pressure here is in the middle of the statokinesigram. So what we do, we calculate the mean data of all the center of pressure points, and we put it in the center of the chart. Then the software posteriorly analyzes all the COP points to calculate different metrics. One of them is the sway index. The sway index is the variation of the distance travel of the center of pressure from this mean position during the test time. So in other words, it's the standard deviation of the center of pressure data from the mean point. The higher the sway index, the more unsteady the person was during the test. Other parameter that we have is the sway velocity. The sway velocity is the distance traveled by the center of pressure divided by the test of time. If you take a look at the center of pressure trajectory, it is possible to see all the center of pressure displacement obtained, and then you can calculate the anteroposterior and the mediolateral displacement between which point, and by knowing this and by knowing the time between each acquisition, in our case 100 Hertz, we can get the first derivative of position. So in other words, how fast the position of the center of pressure moves. The value that we present in our report is the mean value of the end sample. And at last, we have the ellipse area. The ellipse area is the prediction ellipse with 95% of the center of pressure values, calculated using the principal component analysis method. So very briefly, just to explain to you what is this method, it is a dimensional reduction method to reduce the dimensionality of a dataset while preserving as much variability as possible, meaning as much statistical information as possible. Then we calculate the A and the B, the ellipse major and minor axis, with 95% of COP data points. If you are new to posterography or balance, this is an excellent metric to start analyzing, as it is very well known in the literature and a simple measure to understand. So given all this information, let's have a look at the report again. So all these values are presented for each condition here in the table for each of the 6 conditions of the balance error scoring system. And we also have here the composite, which is the average of the 6 conditions. We also have here the test time which is the duration of the test, and in case the patient falls, it will indicate the time until the fall has occurred. All this information can be quickly exported to a PDF report and also view the progress between evaluations and verify the percentage of improvement within the first and last session, like you see here, for each condition. This allows a more objective and quantification look at the balance error scoring system performance, allowing comparison and progress monitoring after rehabilitation. For example, let's look here. We have here an example in the left side with some center of pressure data after a concussion event, in which you can see that the patient has a lot of body sway and even fell here in the last two conditions. And he had 22 errors during this test. And then here on the right side, we can see after 2 weeks of rehabilitation, we can see that the center of pressure is much smaller, and we can see here the values that we calculate with our software. They all got much smaller, and you can even see here also the number of errors, which reduces from 22 to 10 tests. So ideally, what we should have here is a baseline to compare. So each athlete should have a baseline data to compare before and after a concussion event, so as to safely return to competition when reaching those baseline values. So now that we know what we can measure, let's move to some clinical considerations. So here I have here some articles that I would like to show you. Even though there is no normative data for this enhanced version using platforms, there are several studies aimed to provide the normative information using the traditional balance error scoring system. For example, here you can see this article where Grant et al. Administered this score in almost 600 healthy community-dwelling adults, so as to facilitate interpretation of the score performance in patients with traumatic brain injuries or other neurological conditions. Also, in this systematic review, the balance error scoring system shows moderate to good reliability for static balance assessment and can detect balance problems in individuals with concussions and fatigue. Regarding instrumented balance error scoring system with the force plate, it is also shown good to excellent reliability for postural control assessment in healthy adults. And the authors also suggest a familiarization session as practice effects were noted before data recording. In addition, in this article, Kevin et al. Examined the course of recovering on various postural stability and neuropsychological measures after sport-related concussion, in which the BESS protocol was also used, and the athletes with the concussion demonstrated acute balance deficits, which were likely to result of not using information from the vestibular and visual systems effectively. Lastly, I would like to share this article done by Carrie, and they also used the balance error scoring system to find out that postural control deficits are present in participants with functional ankle instability. These results suggest that this protocol may also be useful in screening athletes for postural deficits following lower extremity injury. So, to sum up, there are several considerations that can be established from this protocol. For example, high values of sway velocity with the fit together condition, the first one, on firm surface should be interpreted with caution, as this condition is the same as the Rumberg test, which is a very known protocol, which showed to be insensitive to changes in postural sway after mild injury. In the case of high values in the non-dominant foot or in the tandem position, so the first and second condition, in the second and third condition, sorry, in the firm surface, it is indicative of ankle instability, mainly mediolateral in the case of the tandem stance, and problems with sensory integration or inability to generate a more effective counterbalance strategy due to orthopedic limitations or pain. For the last three conditions, using the phone, I values are indicative of sensory integration. However, biomechanical factors should not be completely excluded. Even healthy individuals can lose their balance in these conditions, in which vestibular inflammation must be used to control the balance. At last, healthy individuals, they will show minimal sway on the firm surface with feet together, and on the other hand, sway increases on the one leg standing and tandem position, and mainly, of course, using in the case of the foam surface. Even healthy individuals may lose balance or fall in these conditions. Finally, now, this modified version of the balance error scoring system allows objective measurement that is reproducible, practical, and reliable, allowing comparison to baselines and progress monitoring after training. So with this, I finish my presentation about the BESS protocol. It's just to give you a look of all the available protocols that we have in our software, the balance software. The BESS protocol is just one of 14, and it is available on all the platforms that we have, the force and pressure platforms. So on behalf of Sensing Future, thank you so much for watching. It was a pleasure to share this know-how with you. If you have any questions, please send to my email, claudiotinel@sensingfuture.pt. I will be happy to answer. And before you leave, we are open to questions, scientific advice. Feel free to ask for a demonstration of PhysioSensing. I can show you the solutions that we have. And here you can have a look at all the solutions available. So we have right now 4 types of platforms, pressure and force platforms, and we work mainly in 3 areas: in podometry, physical rehabilitation, and vestibular rehabilitation. Also, take a look at our blog in our website page, physiosensing.net, where you can find several articles which can be of your interest. And before leaving the webinar today, I would like to make you an offer. So here we have our solution to rehab. It is composed of pressure plate and balance software with 12 protocols and 30 balance exercises. The market price is 4,600. For those that consider this to be a significant investment, we would like also to share with you that we have recently launched a low-cost option, which is the Solution 8 Basic. And it is about half the price of Solution 2, 1,900 euros. It was designed for anyone who wants a more economical solution for balance assessment and training. This system is very portable and connects to a desktop or laptop via USB cable. And it has also a set of protocols, a lot of balance exercises and games. So it is a perfect combination between features and price. So until the 6th of April, we will offer shipping to any place in the world with the approximate amount of 200 euro. So to do it, you just need to make a request to info@sensingfuture.pt and inform that you were present in this webinar. We will wait for your emails, and if you have any questions, like I told you, you can schedule a meeting with me. I will be very happy to explain any of the solutions. So please note that we ship worldwide. We have distributors in 50 countries with local support. And to finish, like always, we have here the date of our next webinar. Closer to the date, we'll open registration and we'll let you know the team. Thank you again and have a great afternoon.